Colorado Public News sat down with members of the House of Representatives from Colorado to determine how they're voting on repeal of the health care bill and what provisions are causing them to vote yes or no.
I'll be voting against the repeal of the health care law this week. This is the most expensive one-page bill in the history of the United States Congress, increasing our deficit by over $200 billion. It's a job-destroying bill. And I'll be voting against it. I think we all agree there's a lot of areas we can improve with regard to health care reform. But we just had a hearing earlier today, and a man with hemophilia testified that if the health care law is repealed, he'll be forced to go into government health care. And I don't think we can afford to force more people to go into government health care by repealing this bill now. And I think we need to move forward in making sure it works for all Americans. I think one of the most exciting parts of the bill is it finally provides an incentive for people to get off of Medicaid. Medicaid is the government insurance for some of the poorest Americans, and right now the problem is if you earn a little bit too much, you lose all your benefits. And I've talked to people in my district that earn $9 an hour, $9.50, and they can't accept a raise to go to $9.75 or $10 because they lose thousands of dollars of health care benefits. So this will provide a route out of government health care, a way to have a sliding scale of assistance all the way up to, for a family of four, somewhere around $70,000 a year in income. So it's finally a way to escape the cycle of poverty that locks people into government dependency. Another important piece I think we have to keep is preventing exclusions and pricing discrimination for people with pre-existing conditions. When you have a pre-existing condition, it's simply not your fault. And to repeal that and just leave people in the lurch who might be a survivor of cancer, who might have a childhood disease, etc., really runs contrary to the very concept of what insurance means, in that it means a way of spreading the risk. And these are things that could happen to anybody. So as we look to improve upon and build upon health care reform, it's critical to keep the piece that allows people with pre-existing conditions to be insured.